Thank you so much for taking time out of your day to join us for the Needy Med special topic webinar, Making Medications Affordable, presented by our partner RX Outreach. My name is Carla, and I am the Director of Education Initiatives at Needy Meds. And before we kick off the presentation, I'm actually going to offer a few tips so you can make the most out of it. First of all, if you do have questions, we encourage you to ask them by typing them into the questions section. For some of you, it may be the chat section of your GoToWebinar control panel. Just know we do reserve answering questions until the end. If you submit a question and we don't get a chance to answer it, we will follow up with you by email. But of course, we will also provide the contact information for both Needy Meds and RX Outreach at the end. Wanted to let you know that today's presentation is being recorded and it will be uploaded onto the Needy Meds YouTube channel. I hope you check that out and subscribe because that's where we post all webinars, videos, and presentations, so you can be sure not to miss out on anything. And also, as you saw before, please check out the handout section of that GoToWebinar control panel on your desktop for materials we uploaded that we thought you'd be interested in. So with that, let's get started with, first of all, making sure everybody knows what Needy Meds is and what we're all about. Needy Meds, what you're looking at right now is our mission statement. That's our fancy wording. But simply put, we connect people to programs that help them afford their healthcare expenses. And we do that free and anonymously through our toll-free helpline, 1-800-503-6897, and our website, needymeds.org. I always like to put a screenshot of our homepage in these webinars just so you can get an idea of what Needy Meds is all about. What you're looking at is a screenshot of the current Needy Meds homepage. And as you can see, it's full of a ton of information. So I encourage you to check that out if you haven't had the chance to do so yet when time allows. In the meantime, I'm just going to point out a few things, such as if you are looking for healthcare savings resources, you would find those under the aptly named Healthcare Savings tab. I'm going to point out where you can find a link to our YouTube channel, which is on the top. Oop, I jumped ahead. It's on the top right. There it is. It's the third one from the left with the rest of our social media icons, which we hope you check out and follow us there as well. And you also saw a red box pop up around that education tab next to the healthcare savings tab. That's something I think worth pursuing when time allows. Check it out a little bit further because under there, that education tab, you can find information such as ways to sign up for our other upcoming webinars or our monthly newsletter, Vitals. You can order some of our Needy Meds materials. And if you're here representing a business or organization, you can also check out ways to partner with us. On the bottom right-hand side, you can also find upcoming webinars on that calendar of events. So as you saw, our mission statement, part of that is educating our users. And of course, we define that by educating users about Needy Meds and the resources we have. But we also fulfill that education part of our mission by educating our users about other ways to save on healthcare expenses, which is why we are always so pleased to welcome back RX Outreach. So let me tell you a little bit about RX Outreach. Look, what you're looking at is their website. Just like I said for Needy Meds, I encourage you to check it out. It's really well put together. You can clearly find out what they're all about and how you can get assistance very simply. So RX Outreach is actually the nation's largest nonprofit, fully licensed mail order pharmacy. It offers more than 1,000 medication strengths at very affordable prices. Mission to provide affordable meds to the underserved, RX Outreach partners with hundreds of clinics and organizations across our country to provide a crucial health safety net for those who battle both illness and poverty. Since 2010, RX Outreach has served over 450,000 people and helped save them more than $880 million on their prescription meds compared to retail costs. And I want you to know Needy Meds has proudly been partnering with RX Outreach for a while, and I am always shocked and moved by how those numbers have increased. I can't believe that they have to date helped over 450,000 people. So we always welcome them back to share how they can help the patients, clients, caregivers, users that turn to Needy Meds for healthcare savings resources. So I'm really happy also that my friend and colleague Bill is here to walk you through what RX Outreach is all about. Bill, as you can see, he's the Director of Marketing and Programs over at RX Outreach. But as I always say when I introduce him and welcome him, is that that doesn't capture really all of the effort he puts into doing his best to help as many people as possible. Bill has worked in nonprofits for more than 25 years and has been at RX Outreach for a little more than 6 now, I believe, but correct me, Bill, if I'm wrong. And it's one of the reasons why we're so pleased he came back to share his expertise and, of course, his passion for RX Outreach and helping those that turn to them. So, without further ado, and I always say this hopefully seamlessly, I'm going to go ahead and transfer the mic and the screen over to Bill. And as he grabs that, I will remind everybody that's here today at Perfect Bill, I could see it beautifully. Oh, and I'm getting feedback from our users that they can, our attendees, that they could see your screen as well. So thank you. So before I pass the mic over to Bill, a reminder that if you do have questions, submit them by typing them into the questions or chat section of that GoToWebinar control panel. With that, I'll pass it over to Bill. Thanks, everybody.
Thanks a lot, Carla. Good afternoon or good morning, everyone, depending on where you are. As Carla said, my name is Bill Vatterott, and I'm really happy to be with you today to talk about medication adherence and affordable and accessible medication. That's what we're all about. RX Outreach is a unique entity, and it's one that, although we've been around for 13 years now, there's still a lot of people who have never heard of us, and we hear almost every day, like, where have you been? I needed you guys. So that's why I'm really glad to be with you all today, and hope that all your questions are answered. I'm going to give a kind of a high level view of RX Outreach today. And I know that our audiences have different needs. Depending on who you are and what you do. So you may be a patient who just is out searching for affordable medication access, perhaps a caretaker taking care of an elderly parent or neighbor, or if you're a clinic or an advocate, somebody who helps people to find resources. Thank you for being here, and thanks for what you're doing. This is a huge issue in the United States, and we're glad to be kind of part of the solution. RX Outreach is not here to replace local pharmacies. We work with local pharmacies. We have chronic medications, and we just want to make sure that everyone has access to the medication they need. I want to start off just sharing a letter that we received, I guess last year, now 2 years ago now, I guess in 2021. And I think it kind of sets a tone for who we are. With each patient that we serve, when they pass, we send a handwritten card with a note to the family. And a few years ago, we received this letter from a patient whose husband was also a patient. She did give me permission to share this. And she just wrote, as you can see, thank you so much for the sympathy card. And then she mentions that her husband passed away. And then the second to last paragraph, I have to tell you that you are directly responsible for a few of the extra years that we had together. There's no way we could have afforded full price for his medication. So I want to thank you very much for the affordable meds. The words on the top of your prescription bottle pretty much say it all: honoring God by serving others. Wonderful letter. And we are very proud of being a nonprofit pharmacy. that is different from others. We put people over profits, and we when I began here 7 years ago, actually, Carla, I think the pandemic has messed up all our time. I think our sense of time, but
It
7 years
has been, wow, oh, 7 years. Yeah. Wow. Okay. Okay. I'm stuck there for a sec, but wow. Okay.
but when I began, I began in fundraising, and I asked my supervisor. I said, "Hey, why don't we just add $1 to each prescription? We sent out a couple hundred thousands of prescriptions last year, and then that will help. That will keep us from having to do any fundraising for the year." And she said, "Oh, you got to get on the phones and start listening to some of the." At the time, 7,000 phone calls that we got each week, and we know that people have a difficult time paying for the meds that they need, and so just $1 would be cost prohibitive for some folks. So let me just tell you real quick, we are going to just do a quick overview, our mission and scope, the how and why. I'm going to go through a few of the special programs, some of our partnerships, and there will be time for questions at the end. So please send those in the chat, and we'll make sure we get to those. So I like to say that the point of any nonprofit is to not exist, because the reason you were created is solved. And why we exist is for medication access, but especially for medication adherence. And adherence is an important issue. It's what, when a doctor prescribes medication, that it is taken for the reason that it is prescribed. And we know that there are a lot of barriers. So starting kind of at 3 o'clock here, patient attitude. Some people have a negative attitude towards their medication or the effectiveness. They avoid the side effects. Um, Maybe they're not motivated. Other people don't take their medication because it's perhaps challenging, the therapy complexity. Adherence is difficult if you have an inhaler or injectables. Or I just was at an urgent care over the weekend and got two medications and an inhaler, and one is every 8 hours, one's every 3 hours, and it's confusing for me even. So people that have multiple medications, it's very challenging. There's also some environmental reasons why people don't take their medication as prescribed. Perhaps there's transportation barriers. That's not just folks in a rural setting, but perhaps somebody in a city that doesn't have access to bus lines, just has challenges kind of getting around. The weather, there's all sorts of reasons. And then lastly, the cost, and that's really where we help the most. Only half of medications, of prescriptions, are picked up from the pharmacy. Only half. And of the ones that are picked up, less than 25% are taken as they're supposed to be. And that means that they're taken when they're supposed to be. I was told take the full 10 days of my medication by the doctor at the urgent care. And maybe after 7 days, I'll say, "Oh, I have enough," and then I just forget because I'm feeling better. These are all reasons for non-adherence, and it's why RX Outreach exists. And one of the things that our program was especially designed to eliminate as many of these as possible. So our mission is to provide affordable medication for people in need, and our vision is that everyone has access to the medication that they need. We began in 2010 and now have served over 500,000 people, saving people over $1 billion on their medications. I'm going to tell you how we do this and how you can have access to this program as well. But we get some donations from pharmaceutical companies, and we're able to pass those free. We always have free medications on our formulary, and I'll tell you how you can learn what those are. And we deliver to all 50 states, U.S. territories. We've been doing this for 13 years now, and we're pretty good at it. So RX Outreach is patient-focused, transparent, convenient, and sustainable. And those are things that I'm going to speak about and give you examples of throughout our talk. So to begin, we are fully accredited and licensed. And this is important because we've had an explosion really in the last few years of kind of some rogue pharmacies that look very legitimate, and they're not. So we are accredited by the National Association of Board of Pharmacies. We report to 50 states every day. We have a very high accuracy rate. I'm going to talk about that in a little bit. But we are part of kind of the charitable Pharmacies of America. We're accredited charity. We're transparent. We're really happy these two awards that we got, just best online pharmacy. You could see we have a 4.7 out of 5 rating on Google, and people, you can go through and see the reviews, and we're really proud of the positive feedback that we get from our patients. So RX Outreach carries around 1,000 medications, primarily chronic, for chronic conditions, primarily generic. In the packet of that is attached to this webinar that Carla shared, you can download this one-page sheet. We have these categorized kind of on a one-page sheet. So if somebody is on an expensive medication, they can bring this to the doctor and say, hey, I get this, but it's really expensive. Is there possible way that I can use a different medication? But we also have every medication searchable on our website. You can use the search bar there, find your medication to look by the condition. You can look by the generic name or by the brand name, and all the prices that we have listed are, uh, is all you pay. There's no other hidden fees. All those prices include shipping. We like to keep it simple because we know that it can be very confusing to get discount codes and coupons, etc. So we work hard to kind of keep it as simple as possible for people. So our program, as I mentioned, is convenient. We mail everything out. So every medication is mailed out. About 90% of the medications are received by the patient in 5 days. Now, because of the chronic conditions, we can fill the medications. We can start 2 weeks before that the prescription is up. So we send a text refill or a text reminder or an email. So would you like to reorder? Would you like to refill? That way we have time to reach out to a doctor if a person does not have refills on their order. And that way we can continue, the person can have that full continuity of care and not miss any days of medication. We don't accept insurance. So the price that you see on our website is the price you get. One of the things that I know I've done in the past is I've kind of held my breath at the pharmacy counter to find out how much medication is, and whether my insurance will even accept it. So that is not an issue with us. We do give the refill reminders and emails. We also do calls out to people. One of the wonderful things that we have is we have pharmacists all over. There's about 40 employees here at our St. Louis location. We're located outside of St. Louis. We have a 31,000 square foot facility where we have all our call center, our pharmacy, and all the pharmacists are in different departments. So someone can always call up from the convenience of their home, from the privacy of their home, and speak to a pharmacist about their medication, about issues they may be having with the medication that we carry that they get from us, or any other medication. We're here to help. We also have friendly hours from 7 a.m. Central Time to 7 p.m. Central Time, Monday through Thursday. And then they vary a little bit on Friday, and then also hours on Saturday. And we answer 70% of the calls within 30 seconds. The one thing is that our first 5 weeks of the year, which we're in right now, are our heaviest as far as call volume. So it's a little bit longer than that now, but we're getting back to everybody. Lastly, and I'm sorry I'm just reading this to you, but RX Outreach is sustainable. So we know that free comes first, particularly for the clinics. And for some patients, free comes first. But we know that those supplies often run out. We do have state-of-the-art technology, so we can process things. A clean script, as soon as we get it in, if we have everything in order, it goes out that same day. And we have the high accuracy rate, so 99.99% accuracy rate, which is above the industry standard. So that means if for this, to put this into numbers, that is out of 187,000 prescriptions filled, there's 18 errors that we had, and those errors are things like if it is 123A Main Street and it we accidentally had 123B. So we take all those very seriously. Um, our accuracy rate is a very very high. And lastly, we just have some strong partnerships. We're part of the healthcare safety net of the U.S. So we work with hundreds and hundreds of clinics all around the country, and with the doctors' offices and different social services. The Unite Us, if you're familiar with that platform, it's like kind of the next generation of 211 United Way. It's a closed, HIPAA compliant network. So if you're in this space, you may want to check that out. They're wonderful. And then I put up the Hep B Foundation logo up here, mostly to remind myself to mention it. A few years ago on this very webinar, some folks from the Hepatitis B Foundation were attending, and they reached out afterward and said, "Hey, 20% of our phone calls in the first 3 months of the year were all about medication costs. Is there any way that you could add these 4 medications to your formulary, to your drug list?" And we looked at it and explored it, and we ended up adding, I think, 3 of the 4. And they were thrilled because it was far below retail and what people could get. And so fast forward about a year later, we got some grant money and donations, and we called up Hep B and said, "Hey, listen, we're going to give uh, anyone who needs it that you tell us about a hepatitis B medication for free." And so we did that for a while, and hundreds of people got their medication totally for free. So those are the kind of wonderful, rich partnerships that we have. So if you need a medication that's not on our formulary, that's not on our drug list, please let me know. Put it in the comments, and we will explore it. That's how we add new medications to our formulary. So we do have income guidelines. So people are accepted that can join our program if they're at 400% of the federal poverty level. Now these just came out. I just looked them up yesterday. So a family of 4 earning $120,000. Now I want to talk about this for just a second. We used to be much stricter on this. Um, and we have kind of, since COVID and with the inflation, well, we've lightened it. So right now we just ask for someone to say yes, that they are in need of this medication, because a lot of people were earning this. This is on income, not on assets. And so people had earning more, but they'd be out of work, and the cost of all these medications. So what we've done now is we're accepting everyone into our program, and over the summer we'll do an audit and just take a small percentage of our patients, and kind of look more deeply and reach out to some of a smaller percentage of that just to ask if they meet that income. Rarely do we ask for proof of income or anything like that. We take a person's word that they have a need. But if you have questions about that, please let me know. But we're not worried about that right now because we know the need is so great and so many people are struggling. So when to consider RX outreach? If a person is spending their own money, or if they've exhausted all the options for free medication and affordability is necessary. If they don't qualify for another program, a patient assistance program, if it's too complicated for them. A lot of times there is a lot of paperwork with with patient assistance programs. If someone's insured, or if the copays are simply too high, that we hear that a lot. I have insurance. Can I come to your program? And absolutely, you can't use the insurance, but like I said, our prices are oftentimes lower than the copays. If a person is undocumented, and they need medication assistance, we serve people regardless of their immigration status. They have multiple medications, some that are more expensive, the transportation barriers I spoke about earlier. If their pharmacy doesn't have what they need, which we're hearing more and more in rural parts of the country, that the pharmacy just doesn't have all the medications. And if they want simplicity, again, we are very transparent with our pricing. What you see is what you get. So now what I'm sure you've been waiting for, how to actually get enrolled and use RX Outreach. So patients must be enrolled, and um, by enroll, I mean just we have to get your information like any other pharmacy. So a patient can do this themselves, um, or a clinic, a case manager, an advocate, someone else can. So we have a few different ways to do this. One way is just to go online, and there's um, on the Find Your Medication page, you can see kind of three enrollment forms. One, somebody can just fill out a simple form with their name and phone number and email, and we'll give you a call. We'll reach out to you and talk about the program and answer any questions and get you enrolled if need be. You also can call one of our phone numbers. There also is a downloadable application that is fillable. It's a fillable PDF, and you can complete that and send it in. Um, any of those ways. Um, we a lot of people now are kind of using the enrollment form. We carry generic Adderall, so we've had a stock of that, and you may be aware that there's a national shortage. So a lot of people are coming to us for that. And then Pfizer, their patient assistance program, they rolled a number of medications off that we carry. So a lot of people from Pfizer are calling us and enrolling as well. And so we're any of those ways. Um, we also if you want to just submit um, a prescription to us. So it can be e-scribed, or the pharmacy can, that the doctor can e-scribe it or fax it, or even if it's a non-control, it can come from another pharmacy. So another pharmacy, you could say, can you send this to RX Outreach? And they'll send it to us. That also initiates the enrollment process. When we get that in, we will reach out to the person and to get them fully enrolled. So we can transfer those. And then as soon as payment and all of the prescription is here, and if it is a control that we have a license, then the medications are shipped out. And as I said, we do all the simple reminders to people. So a few other specific programs, depending on if you are in the clinic space or a doctor's office. We also have a preferred program for our partners, and this is the only program that has kind of we have a discount. This is the only kind of way we have a 5% discount on our medications for our preferred partners. And one is that the clinic pays and that we just invoice them at the end of the month. So anything that comes in, we'll send it. Another is that the patient pays. So a clinic or doctor's office will send in the prescription to us, and we will reach out to the patient for payment and get it shipped. Or else, some clinics, places have both. We do have a clinic portal um, that you can manage and manage all the patients and get reports. So that's available. It's being upgraded right now. Excuse me, but it should be out in the next couple weeks. Just a little example of our clinic portal. We also have a program called Serving Those Who Serve Others. This program was started because of the employees here at RX Outreach. Some of us said, hey, we get a medication from here, but it's expensive. And so they first started giving us kind of that benefit that if we needed a prescription from here, we got it for at no cost. And then they realized that a lot of companies had issues like this. They weren't able to offer people full benefits. Some people were their part-time employees or even volunteers, and they still needed access to medication. So we brought this program, Serving Those Who Serve Others, that any business, especially nonprofit, is able to enroll their patients and refer them to us, regardless of insurance status, and they can join our program. We also have a wonderful program called Healthy Reentry. And what it does is it provides 60 days of medication for people getting out of prisons or jails. We started this program in St. Louis, piloted it, and then we actually expanded it to the entire state of Missouri. So everybody getting out of prison would get medication. There wasn't enough time here in Missouri. Um, someone gets 30 days of meds when they get out of prison, and wasn't enough time for them to get to a doctor, a clinic, and have a continuity of care. So we started this program. It was wildly successful. Half the folks received mental health meds, and so it really helped them with that transition, and it was at no cost to them. So the program now is included here in the contract in Missouri and in a number of other states. So right now it's in New Mexico, Wyoming. There's a number of mental health courts that are using it, and then it will start in Alabama in April. So this is a program that is a little bit separate, but I wanted to let you know about it because it is an important part of public safety, and it's an important part of recognizing people in need, and people are especially in need when they get out of prison, which many of them it's their very first permanent medical home, and kind of get out into the world to before they can find doctors and afford it. So the probation officers especially love this program because a lot of the folks that they supervised, they were having them go to ERs in order to get their medication. So we're very proud of this program. So just want to encourage you before we finish up here to sign up for our monthly newsletter. Um, this is the program. This is how we tell people about the free medications that we offer each month. We offer between 15 and 20 medications completely free of charge. It's first come, first serve, but we always send it out in our once a month newsletter. We also always explain the new medications that are added to our program. So last month, I think we added 8, and these were for cancer, for arthritis, for high blood pressure, and we are just adding. I just saw the email right before we got on today. They're adding another 4 medications to our formulary this week. So I'll put that out in our newsletter in the next couple days. So please sign up for that. It's once a month, and it's very easy to read and keeps you updated on the free ones especially. So I want to thank you for your time and attention here. Thanks especially for being kind of part of this solution. I'm the only marketing person here at RX Outreach. So if you can help others to learn about the program, we can believe that everyone should have access to this medication. And our pharmacist here, Taylor, is one of them who said, "I need a picture here, and I need it next." And I said, "Where do you want it?" She said, "I want it next to our vision." So the vision that we really believe that with all of us working together, that everyone can have that access to medication. Thank you very much, everybody.
Bill, thank you so much for taking time to share once again your expertise with Needy Meds and our users. It's such a great resource, RX Outreach, that as I said, we've been proud to partner with over the years. A couple of things I'd love to take a moment to just stress. As Bill said, he's the only marketing person at RX Outreach. And although after you feel sorry for how exhausted he must be, you also have to realize that that really speaks volume to the business model that they follow. And it goes back to that story and that letter that Bill shared when he kicked off his presentation. Um, how RX Outreach directly helps people and changes their lives, but also how he shared that when he first came on board, he said, let's just ask everybody for $1. And the team at RX Outreach simply wasn't doing that because every last dime that they're able to save the patients, that's where all of the money goes. So when you hear Bill say, "I'm the only marketing person here," that's because they're doing the best that they possibly can on the least amount of money to make sure that they're efficiently running that organization, efficiently running their pharmacy, and to make sure every last cent that's possible can go onto the user and their patient. So couple of things. Bill also put up, well, he talked about very importantly how to get the help if you need it for yourself, a patient, a loved one, a client, a neighbor. But there are other ways that you can also help spread the word and support RX Outreach. Bill had some of those suggestions up. I always encourage users to, easy enough, visit their website, share it with those you love. The second way, simply follow and post about them on social media. And a great way also, take a moment to write a Google review about RX Outreach. It takes just a moment, but it really does have prolonged reach. So take a moment to do that if you would. I do see a bunch of questions coming in for Bill. They're all great questions. As I said, we'll do our best to get to as many as possible. In the event that we can't get to yours, we'll have our contact information up at the end, but we'll also reach out to you as soon as we can via email. So before we get to those, I want to remind everybody that what you're looking at on the screen is a list of all the healthcare savings resources you can find on needymeds.org under that healthcare savings tab. To learn more, there's a number of things you can do. Simply check out our website, look around that healthcare savings tab, reach out to one of our call center counselors if you're having trouble affording a medication or another diagnosis related need, or check out our upcoming webinars. And again, you can find those under the Education tab next to that Healthcare Savings tab, or on the calendar of events on the bottom right hand of our homepage. The reason I'm pointing out webinars is because we populate that upcoming webinar schedule with partners and their resources, the healthcare savings they have, and the educational information they can offer, like RX Outreach. So check those out. But you will also find Needy Med's overview webinars, usually titled something like Save with Healthcare Costs. And we also offer quick webinars that do deep dives into all of the different categories that provide healthcare savings resources, such as some of the ones you're looking at on your screen now. So check those out when time allows. With that, a reminder to submit questions, how to do that. And as promised, I want to leave the contact information for RX Outreach up on your screen. And at the bottom, you will find my email address. That's Carla with a C, carla@needymeds.org, as well as the contact information for Needy Meds. Simply needymeds.org, 1-800-503-6897. I'm going to say the RX Outreach contact info out loud because we do have a lot of people I know that like to listen in on these webinars and not necessarily look at the screen. So the phone number for RX Outreach is 1-888-796-1234. And again, that's 888-796-1234. And their website is simply rxoutreach.org. Any questions, drop an email to questions@rxoutreach.org. So Bill, a bunch of questions coming in. We'll get to as many as we can. And the first one, you did address this, but I really, usually people ask, I'm seeing a couple of questions that came in and they usually ask it before you even really get into the beef, the meat of the your presentation. So I'm sure you did address these, but I think it's a great opportunity to drive the points home. And the first one is, can I use RX Outreach if I actually have insurance?
Yes, that's a very common question. You absolutely can. We are glad you can. We know that that oftentimes falls short of what people need. So you can. There's no penalty. I worked here for 5 years, I think, before my mom started using our program. She went to the local pharmacy because she could make two right turns, but there was always lines, and it was just always the pharmacist was off, and she was really afraid that she would get in trouble. So there's no penalty. They don't really care as long as you're getting your medication from somewhere.
Thank you so much. Yeah, really, really important question. And another one that came in, and again, you did address this, but this is important. How much does RX Outreach cost?
Sure. There's no membership fees. The only price is the only cost is the cost of the medication. So whatever price is on the website is the price that a person pays. There's nothing else. I want to. I did actually want to address something that Carla said too with our phone number. You may have noticed that I added a 314. That's a St. Louis area code, a 314-222-0472 phone number. So we're starting to kind of push that one, and that's because remember the days when we used to have to pay for long distance? We had the 1-800
I
number.
do remember that.
Right. Yes, the 1-888 number. It's free, right? But it actually costs us per minute for using. And we were going through how can we save money. Anything we can do to cut costs so we can keep our prices as low, particularly with all the inflation. And we're facing it too. So they realized that most people have cell phones now. There's no charge for long distance. So we said, well, let's use that, and it'll save us a lot of money each month. It's the same reason why we're not. We oftentimes get asked, why aren't you on GoodRx? Everyone knows GoodRx. We'd love to be on it, but it would just be cost prohibitive for us. We would be way cheaper than most of the medications on there, but it just we couldn't do it. So we try and keep everything is low cost as possible. And as Carl mentioned earlier too, it's one of the reasons that our website, which we should see improvements in the next couple weeks, with our patient portal, with being able to enroll. That's because we try to do it on the budget that we have to keep our prices so low.
Such a great question and a really thorough answer. And I'm really glad you brought up that little tidbit about GoodRx because, as a matter of fact, that was one of the questions that a couple of our attendees did ask. So thank you, Bill. Another question, if you don't, and I think we are getting a ton of questions in, and I love that, and I know Bill does because it shows people are interested and people are really figuring a way to learn more about our RX outreach, use it for themselves, or spread the word. So don't worry if we didn't get the chance to answer your question. As I said, if you need an answer right away, you can reach out to that phone number. And Bill, can you say the updated phone number again?
Sure. The updated phone number is 314
Because I am
222.
just bear with me, guys, because I want to put this in live time. I'm going to update my PowerPoint. So go ahead again.
Sure. It's 314 222 0472.
Perfect. I just want to make sure that our attendees have the most current information, which is why we welcome RX Outreach back. I think you do webinars about quarterly, and it's super important because RX Outreach is constantly trying to find ways to make their pharmacy more efficient and make the experience a lot more user friendly. So I'm actually glad we had that opportunity to update that phone number because it really shows that if you have attended an RX outreach webinar, if you see it pop up on the Needy Meds calendar again a few months from now, it makes sense to join us again. So thank you so much. And as I said, if you asked a question, we didn't get a chance to answer it, you can reach out to that phone number to ask a question if you need an answer immediately. You can also drop an email to questions@rxoutreach.org. Or, as I said, you will get a response via email for any questions we didn't answer from Bill or another RX Outreach team member as soon as they can. So let's wrap it up, Bill, with one more question. Although there are a bunch of others that came in, we do try to keep the question segment relatively brief. But I'm going to wrap it up with this one. It came in pretty early on, and I also think it's an important question, one that you've probably gotten before as well, which is, where does RX Outreach get their medications, and are they safe?
Sure, that's a great question. So we buy about 85% of our medications. We buy directly from the manufacturers, and we also belong to a group purchasing organization that is the same one that all the Walgreens and Walmarts and others belong to. So we buy it directly from the manufacturers and then through our group purchasing. And we get about 15% that are donated. Now, one thing that's important is we do not do short dated medications. We are always aware of kind of the supply chain for all our medications. So I didn't get into the details of kind of the high tech part, but every single bottle, every prescription that's filled, we weigh it and we take a picture of it. So if someone says, "Hey, I got this, I was supposed to get these pills and I got these," we can go back and check because sometimes the manufacturer does change kind of the look of the medication, and we try to let people know. But additionally, we can always say exactly where the medication came from. It's reason why we're part of a group called Partnership for Safe Medications that kind of helps protect our medication supply. Um, I knew that we kind of had made it when I discovered a rogue pharmacy a few miles over the border into Canada that was using our name, and we tried to squash it, cease and desist it right away. But the reason that we have been in existence for as long as we have, excuse me, and have the reputation we have is because we really protect our patients. And all that is through our medications as well.
Thank you so much, Bill. I think that was a great question and answer to wrap up today's presentation. I did get some users asking again to say that most recent phone number out loud. And again, let me just make sure you guys are seeing my screen. Hold on. Yes, you're seeing my screen, right, Bill?
Yes.
Okay, great. So the phone number that Bill shared that I updated that PowerPoint slide with is 314-222, and I'm typing this into some of our attendees as I talk, 314-222-0472. And again, the website is rxoutreach.org, and the email address is questions@rxoutreach.org. So, Bill, as always, a pleasure to have you as a host for a Needy Med special topic webinar. We love having you come back because we are big fans and really truly value our partnership with RX Outreach. And of course, a big thank you to this great group of attendees we had today. A lot of participation, which we really appreciate. Thank you for your time, everyone. And as I said, check out our upcoming calendar events to see if there are other webinar topics that you're interested in as well. Thanks so much, everybody, and have a great rest of the day. Take good care.